Hello class, I'm Mario, and today in my informative speech I'm going to be talking about the difference between a midwife and an OBGYN. So most women, whenever they get pregnant, they automatically think that they need to go to an OBGYN and that is their primary form of healthcare and their best option. However, that is not always the truth. Only 10% of deliveries in America actually need use of an OB/GYN. They are highly trained doctors who can take care of the highest critical pregnant woman. And 90% of deliveries can actually go assisted with a midwife. A midwife, which I will go on to explain later, but things that are concerning in America right now are the high C-section rate. 32% of deliveries here in America occur by C-section. And part of the reason why we have C-sections are in case of emergency to save a baby or a mom. But compared to other nations, our infant mortality and maternal mortality is still pretty high. And part of it could be due to the health problems that we have here in America, such as diabetes, heart problems, and blood pressure issues, which can seriously affect your pregnancy, and then also pregnancy brings their own problems. But a part of it is how we care for women. It has been shown that the use of midwives can reduce the amount of maternal and infant mortality. And we can see this through how Sweden and Norway and Finland and those Scandinavian nations which do so many amazing things already, they have a very low maternal mortality. If you go to slide 1, you can see that they have significantly lower numbers. I think it's 4 deliveries or 4 deliveries per 100,000. They have a mom who passed away. And that statistics is very low, which is very good because we don't want none of our moms to pass away. And part of it is due to the care that they receive from midwives. 67 out of 1,000 deliveries over there in Sweden have the use of a midwife, which is amazing. So let's explain the difference between a midwife and an OB/GYN. So let's begin with an OB/GYN. So an OB/GYN or a doctor, they are highly trained individuals who have gone to 4 years of pre-med school and have completed another 4 years of medical school. And they also have up to 8 years or maybe even more specialized training in obstetrics and gynecology. So care of women and uteruses, people with uteruses, and problems that can happen with the women. They have a very medical mindset about stuff, believing that the body is flawed and that their help is needed in order to fix things. Which, depending on your pregnancy, might be what you need or might definitely not be what you need. As stated earlier, only 10% of deliveries actually need an OB/GYN because there is a critical issue that a highly trained practitioner can care for. And then there is a midwife. A midwife can complete, they can have a degree in nursing, depending on the type of midwife, but like the best midwife you would get has a degree in nursing. They might have prior experience as a labor and delivery nurse, and they might have at least a minimum or more years of training in midwifery with a midwife who already is experienced. And they have a more naturalistic approach to labor and delivery, believing that labor and delivery is something that happens naturally, and pregnancy is something that happens naturally, is something that is beautiful, and it's something that you should trust. It doesn't mean that they don't use medical interventions. They might just use minor medical interventions. They might not use as many hormones. They can definitely not do surgical interventions. Like in case of like an emergency, you need a C-section, it wouldn't be your midwife, it would have to be an OB-GYN who would have to do that, because that is just not within the scope of practice. They deal with low risk deliveries, which is 90%. So 90% of your women here can have the care of a midwife. A benefit to having a midwife is that they are less costly than an OB-GYN, meaning that women with lower income can actually receive their care, which is amazing because people in those communities have less autonomy and they don't really know about the options that they have, and at times are really afraid going into pregnancy. Midwives can help bring that confidence back, help and remind women of the power that they have in their pregnancy. And a big impact about having that experience during your pregnancy is that it carries over for life. It's a very big moment that can help break or make the relationship a mom has with her child, and also contributes a lot to their mental health. Such as how some moms suffer from postpartum depression and stuff. This can significantly help them. Another thing is about the statistics about decreased maternal and infant mortality. Midwives can be there present for the whole pregnancy and can detect things and can delegate things higher up until a doctor. The use of a midwife can help decrease this, as you can see in slide 2, as well as the decreased mortality of women of color who typically are of lower income. The use of midwives can significantly have a positive impact on the care that we deliver to women. And of course, it is your option what care you believe, but remember that you have these options. Thank you.